My name is Sam Harris. I'm a BCBA, a board certified behavior analyst. I'd like to address the question today: can you treat schizophrenia or other significant mental illness diagnosis like bipolar using ABA? And my short answer is yes, hopefully. When I was very first an intern, just beginning to practice, I was encountering those cases that I had where as adolescents they were just picking up those significant, those serious diagnoses. So I go to my supervisor and I ask her, have you treated some of these cases? How does this work? How can it be applied to help them? And she answered, no, I can't compete with the voices in their head. I thought about that. It didn't really sit right with me because while I definitely agree with the principle of, as practitioners, we need to practice within the area of our competence. That's important. But at the same time, I'm thinking, okay, wait, if we're gaining better understanding over time of how human beings operate and the principles of behavior, then we ought to be able to use this understanding to help those individuals of greatest need. So I didn't want to just say, well, it can't be done. It didn't feel right. So I started to address those cases at that time and grew in my willingness really to work in that area. Sometimes I'll fundamentally disagree with those other individuals involved in the case. For example, sometimes a group home manager, case manager, somebody like that will say to me as I come onto the case, this person does these things, these maladaptive behaviors. They do these things for no reason. It makes no sense. And, I don't agree with that because although I might not yet understand the function and the point of that behavior, or maybe I don't agree with it, maybe I wouldn't do it, doesn't mean they don't have a reason and there's not a logic behind it. And so as a behavior analyst, I need to sort out what that reason is and address it in that way. And in a way, my title, Can You Treat Schizophrenia with ABA, is a little bit misleading because kind of inaccurate. We as behavior analysts don't actually treat the diagnosis. We are treating the behavioral manifestations of that disorder. We're treating the behavior. And in a way that's easier because you know how sometimes you'll see a psychiatrist or a psychologist, some of them might legitimately disagree over a tricky diagnosis. Whether they're seeing a schizoaffective disorder or not, two individuals might legitimately disagree. As behavior analysts, we're just looking at the behavior. We're trying to define what's going on here. And pretty much we can all agree either the person is or is not eating non-food items. Either they are or are not damaging their body. So the behavioral definitions are easier to pin down and they're easier to work with. Makes our job easier. So that's a good thing. Generally speaking, of course, we're only called upon in those cases that are more severe and more chronic. Otherwise, they don't call for a behavior analyst. And I'm not saying that working with those cases is easy by any means. What I'm saying is it's worth trying. These people are worth our effort to use the area of skill that we have to assist. And so I feel like BCBA should be more involved in these cases as the opportunities come up. Or at the very least, do not be intimidated or afraid to help these individuals. With these diagnoses. So having said that, of course, if you're going to take one of those cases and address one of those cases, you're going to have to be discerning about the interventions that you're going to be able to use, understanding what's going to be relevant to that client and in that setting. It's a more complex case than if you've got a toddler who is newly diagnosed with autism compared to a 23-year-old with multiple diagnoses. They're a more complex human being at that stage in their life because of their learning history. There have been times when I have told a team, after doing an assessment, I've told a team, you know what? I don't feel like this person is going to be a good candidate for ABA services. It happens. And you need to be honest. If either the situation, the setting doesn't feel like it's going to be conducive to that type of service, or there are limitations in our professional ability where we don't feel up to taking that case. It's better to just be upfront with everybody and tell them, you know what, I don't feel like I'm going to be able to handle this well. And there are times, for example, let's say you've got a team, a support team that is just clearly not going to work with your program. Or let's say the system has brought them to that individual, the client, to a point where they're living independently. Well, if they're entirely in control of all of their environment and all of the reinforcers, I don't have tools to work with, and so I will just tell the team, I don't think this is going to go anywhere. So circling back to my very first question, can you serve individuals with a diagnosis of schizophrenia using applied behavior analysis? And the answer is, God willing, yes. So I hope that kind of triggers some thought and makes you consider and think about the possibilities there. And I thank you for your time today. God bless.